Hello everyone, my name is Christopher Gallucci, and I would like to welcome you to my Doctoral Practicum presentation on health and all policies. The goal and purpose of this practicum was to raise awareness, educate, and encourage public health professionals to utilize a health and all policies approach to work with governmental entities and policymakers. I chose a scientific poster format to deliver information on HIAP at the NACCHO annual conference, mainly because the conference is the perfect venue because of its national membership base, which consists of about 3,000 local health departments around the United States. The research question for this practicum is the following. What are the necessary topics to be included in creating the curriculum to be delivered as a poster presentation, focusing on the implementation of health and all policies for public health program managers at the NACCHO annual conference? Given the fact that health and all policies is considered the future of public health, it is very significant and important for public health officials and program managers who work at local county health departments to have a comprehensive knowledge of all types of methodologies and current best practices in order to maximize their professional skills, as well as the collective capacity in the delivery of public health interventions. So health and all policies is what we consider a public health 3.0 solution. And when I say public health 3.0, that implies that there is a 1.0 and 2.0. So loosely stated, these numbers represent progress in the way that public health has evolved over the years. In the beginning, the focus was mainly related to eliminating unsanitary conditions to help stop the spread of disease. Then as medicine advanced and we gained a better understanding of disease prevention, there's a shift towards more messaging and education and more preventative measures such as vaccinations, the creation of safer working conditions, environmental protection. Those are what we call our public health 2.0. So efforts under public 2.0 have led to significant progress, dramatically increase in life expectancies. However, a global landscape that is changing and growing exponentially has led to the recognition of that there's a need for public health modernization, because right now we're reaching a point of stagnation, mainly because of declining revenues, budgetary constraints, booming populations, and complicated social problems. In recognition of this, the United States Department of Health and Human Services laid the groundwork to enhance efforts and broaden the scope of public health practice by formalizing the concept of Public Health 3.0 in 2016, of which one of the vital components includes collective action and intersectoral collaboration, which I will discuss shortly. So now, where does this tie into health and all policies? And the best way to think of this is that if Public Health 3.0 is a way to categorize a style of public health, HIAP, or health and all policies, is a framework or methodology that helps guide those public health efforts. The overarching goal of health and all policies is to impart a critical consciousness among governments and decision makers regarding the future impact of policy decisions on health and sustainability. Through HIAP, a framework is provided that creates opportunity for health governance to occur by addressing social determinants of health and health equity through a multitude of interrelated policy-driven cross-sector partnerships. The success of health and all policy hinges on intersectoral collaboration. Health and all policies is characterized as a whole of government approach, where partners are required to negotiate and navigate differences in values for the sake of developing policy action that targets a reduction in health inequities. Intersectoral collaboration between different governing bodies and organizations also elicits a more powerful and efficient horizontal governance approach, which involves the highest levels of leadership. The benefit to this is that an increased engagement and commitment of all stakeholders boosts the programmatic efficiency by allowing for a sharing of expertise and resources across multiple agencies, which will therefore reduce costs, redundancies, and maximize outcomes for disparate populations. To help illustrate application of health and all policies and intersectoral collaboration, we should probably discuss some examples to make it more clear. You may or may not be aware, but some types of public health initiatives that might fall under a health and all policies umbrella might include tobacco laws, municipal building codes, seatbelt legislation, and environmental protection laws. Think of health and all policies as the place where policy and public health intersect. Instead of advising teenagers not to smoke or telling people not to litter, we work on changing the social and political environment that directs health behavior. For example, a traditional approach to try and lower rates of childhood obesity would be to visit schools and teach about healthy foods and physical activity. Meanwhile, the school is still serving unhealthy lunches and snacks and no longer has gym class, possibly because of budgetary limitations. Under health and health policies, intersectoral collaboration might lead to mandating healthy school lunches and providing the necessary funding to hire a gym teacher. Finland and South Australia are actually trailblazers for health and health policies. Both utilize a form of health impact assessments or a health lens analysis, which are basically tools that help evaluate the impact and relationship between policy and legislation on the population. Although relatively simple in concept, health and health policies has been identified as being confusing and complex regarding its development, implementation, and evaluation. A lack of political will or buy-in, as well as a poor understanding of the potential benefits of utilizing a HIAP framework, has the effect of creating disinterested parties, as well as a poor uptake of healthy policy improving initiatives. Compounding this issue, complex and fragmented organizational and governmental systems makes it difficult to identify a starting point for implementation. And due to the necessity of policy implementation for long-term HIAP survival, the issue of sustainability emerges, especially in the absence of financial and political support. For purposes of the practicum, the diffusion of innovations theory was applied. Through this theory, Everett Rogers sought to explain the process and reasons behind the adoption rate of new ideas within a social system. Rogers believed that the rate by which an innovation, in our case health and health policies, is diffused, or communicated within social circles over a specific time period, is dependent upon individual perceptions in relation to relative advantage. For example, the most adventurous individuals, called innovators, constitute 2.5% of those in a social system and are the first ones to adopt an innovation. The subsequent categories of individuals, early adopters, early majority, late majority, or laggards, tend to be increasingly more scrutinizing and rely on the opinions of their predecessors before adoption. By leveraging the diffusion of innovations theory, campaigns and messaging can be tailored in a manner that might potentially maximize uptake and diffusion within a social system. Poster presentations are a practical and appealing medium to convey scientific knowledge, ideas, or research findings. The combination of a well-constructed poster and engaging presenter is effective at stimulating interaction and discussion. Other advantages include that a poster is a low-stress way to deliver research findings and that it helps novices build oral presentation skills. Academic posters on display are exposed to a wider audience, which proliferates opportunities for networking with peers and other professionals. Among the disadvantages include a lack of consensus regarding poster format and elements, as scientific forums either have very specific formatting guidelines, very few, or none at all. Disputes exist over the validity of poster presentations, with some critics arguing that this medium is only beneficial to young researchers in comparison with more rigorous academic components. So here we have the small-scale version of the scientific poster for the NACCHO Annual Conference. Now, the content for academic posters will vary according to the subject matter, nature of the content, author preference, and requirements of the hosting venue. However, among the most common elements of an academic poster include the banner, the title, poster content, some types of graphics, and the references. The flow of an academic poster must be logical and easy to follow for the reader. Appropriate color combinations should be utilized, which allow for background contrast that is not too harsh or jarring. Color variation should remain minimal to avoid creating a busy or distracting design. And due to the unlikelihood that people will read the poster in its entirety, it is good practice to include bulleted lists and phrases that highlight the most important takeaway points. The font size of the poster banner should be large enough to make it visible up to 20 feet away, while the font size for the individual poster sections should make content readable from 3 to 5 feet away. This practicum would not have been possible without the help of my committee members. Each committee member was carefully chosen because of their unique experiences working in different public health sectors, therefore allowing them all to provide a variety of mixed opinion and perspective. Committee members recommended that I strongly focus on intersectoral collaboration, as well as provide some real-world examples so that the audience can relate and understand. The scientific poster would be delivered at a 3-day-long NACCHO annual conference located in Orlando, Florida. However, due to COVID-19, there is a chance now that this may change to a virtual format. The subspecialties of conference attendees would range from environmental health, behavioral health, health education, community health, and health policy administration. Reflecting the dynamic profile of the public health workforce, 2/3 of the conference attendees would be women and the median age would be 46 years old. Approximately 88% of the audience would be reported as white, 7% black, and 6% Hispanic, with English as a predominant spoken language. More than half of the audience would have at least a 4-year college degree, while 28% would have at least a graduate or professional degree. Although the application of health and all policies will vary according to the different jurisdictional needs and the dynamic nature of politics, previous examples of implementation can be used as a framework to establish new HIAP initiatives that are both promising for addressing the social determinants of health and health equity concerns. In theory, health and all policies is an exceptional approach to addressing the needs of a population. However, knowing where and how to begin a successful program is both confusing and complex. For anyone who is interested in developing his or her own initiative, it is recommended to begin by assessing the local political climate and garnering buy-in from community partners and government leaders. After receiving a pledge of support from multiple parties, previous HIAP models should be used as a scaffolding to build a new program, but with the understanding that every HIAP model will embody its own characteristics and modus operandi that fits the needs of its idiosyncratic landscape. Lastly, it is recommended to thoroughly evaluate every HIAP program and protocols so that the data may be utilized to inform future best practices.